and turn it over to our assessment colleagues.
Um, by any chance, can you give us access to share our screen with me and
Oh,
Alice Banks? Thank you.
you should have access. We must have set this up incorrectly. Um, why am I not seeing the right tools?
Yeah, I'm not either.
Those tools, lock the meeting, participants. All right, let's go back to host tools, advanced, share.
There you
Hey,
go.
there you go.
All right. Thank you, guys. So again, good morning, school charter leaders. So I'm Neil Tulabing. I'm one of the assessment specialists. Together with me is Alice Banks, who's also another assessment specialist. I'll let her introduce herself during the respective slides that she will be presenting. So today, this is going to be an overview for new charter leaders. This is not um, a presentation that you can actually explains the whole thing for all the assessment. This is pretty much an overview. Based on NMAC, you have test specific trainings that you have to attend. You also have the test securities trainings that needs to be attending to throughout the school year. So without further ado, let's start, Alice. All right. So today, we have the following overview that we'll be discussing: context of the state assessment system. We have the state and federally required assessment programs, the role of the charter school director in terms of testing, cost of assessment programs, highlights of assessment programs, and available resources and assessment literacy supports. Next slide, please. All right, let's talk about balance assessment system. So pretty much, if you haven't heard this presentation coming from Lynn, this is the balance assessment system that we use for New Mexico. We use this balance line. Oh, what happened? The balance line where you have the formative assessment on the far left, and then at the middle, you have the local assessments. And then on the right side, where you have the end of the year state summative assessments. One thing that we always mention here is if you're looking for the assessment for learning on how you improve your instructional practices, you always focus on the first two green boxes that you have here, which is your formative practice and local assessments. Because pretty much these two assessments are the one guiding your instruction in the classroom. What we have here on the far right, which is the end of the year's state summative assessment, is the assessment of learning. What does the student learn throughout the whole school year? Okay, what that pretty much you use as a charter leader to assess on big things or big rocks that you need to address for your next upcoming school year. And then on the right part of this slide is actually the memorandum for the assessment and accountability program requirements. So there's an active link in this presentation that you will also have after this presentation. Next slide, please. All right. So establish baseline measures and monitor progress. So technically, you want to have to diagnose and the strengths and the weaknesses of the unfinished learning from the prior years. That's one I know that you're good at already. But we also have a couple of things that we embed in terms of assessment, in terms of providing you a good check on what's going on. So let me go back to the previous slide that we had. As you can see in the smaller circle here, which is your formative and formative practices and local assessments. In terms of the local assessments, we do have the interim assessments that you use, which is your BOY, MOY, and EOY. Some of the districts that we are actually providing assistance for assessment, they use their EOY data as well in comparison to their state assessments to give you what are other things that other data points that you can use for the upcoming school year. Another thing that I would like to discuss to you as an overview are the screenings. that needs to happen, especially for your different subgroups. So screening for potential EL, English language learners, dyslexia screener, and gifted screener. So those three things, we're not going to go into the details with those three, but we have active links here in the slide where you can actually use as a reference in getting more information about those screening. And then all grades monitor academic performance is to identify local and state assessment that can be used to measure students' academic progress towards grade level standards. Next slide. So the state provided progress monitoring resources that we have, please note the iStation here now is the Amira. So we have the K to 2, which is a required um, assessment for the interim assessments that you have. And if your student is not proficient um, for the BOY, then they have to do the progress monitoring uh, under Amira. And then we also have the IMASA, which is an interim assessment that we provide for free. Though if you're not a CSI MRI schools category, which is I'm pretty sure you're not right now, you can actually choose whatever interim assessment that you would like to use for your students. But technically for grades 3 to 8, you need to have an interim assessment for the BOY, MOY, and BOY. For the College Board, the following state provided progress monitoring are for Math and ELA, Khan Academy, SSQB, and release operational forms. And then for DLM or the dynamic learning maps, this is for the alternative setting of assessment. We had the instructionally embedded formatives. All right. So ESSA required Title I end of the year summative assessment. So these are all mandated coming from ESSA. So on the far left, you'll see that English language learners, including with EL with disability, has the following assessment. You have the access for ELLs and ELP for K-12. And then at the middle of the slide, you have the all general education students, including EL students and students with disabilities. They are being measured for grades 3 to 8 under math, which is MASA or Cognia, was the vendor platform. Same goes with language arts. And then SAT for grades 11. So out of the high school grade levels, we were asked as a state level which grade level needs to be assessed, and New Mexico chose 11th graders to do that. So for 11th grade, we use SAT School Day for the end of the year assessment. Same goes with Spanish Reading SPA. And then for ASR or assessment of science readiness, we have 5, 8, and 11 under Kansas University or KU. Now for alternative assessment, we use the counterparts of all the general education assessment that we provided. We have BLM, which is under Kansas University as well. That's being covered for math 3 to 8 and 11, science 5 to 8 and 11, language arts 3 to 8 and 11. And then we also have an alternate access for our EL students, which is we call alternate ELP K-12. So you as a charter leader, what are your roles for assessment? So right now, when you start the school, please make sure that you formally assign a district test coordinator via form. So we have an active link here. Here's the reasoning coming from the NMAC regarding the standardized testing procedures. Sign the superintendent post-testing verification form, acknowledging that all state-mandated assessment have been locally administered by the end of the school year. One more thing I would like to communicate here is we sometimes get some communication coming from just the DTC. A quick introduction. Hey, Neil, I'm the new DTC of this and that. Technically, we don't acknowledge that until we hear it coming from this form. This is the official form that we use. So each charter director needs to actually fill this out for us to provide some access to your DTCs. Again, there's a lot of information in the district desk coordinator portal that they will be getting access with, and we don't want just a random person not that that you did not authorize that will be getting those access in our portals or vendor platforms. So again, please be reminded when you're ready to assign a district desk coordinator, make sure you validate this form, you complete this form. And if you change a DTC in the middle of the school year, don't hesitate to fill out this form again. Next slide, please. All right, so we call this as the Big Four, the big primary DTC resources. So we have the PED website. It's being monitored by my team, by our team, every single year. We always make sure that things are updated on this website, including our contact information and who's the point of contact for each of the assessment. We also have the state testing calendar here, where it's up to date. You can actually look this up using the active link in this slide on what are the dates that needs to, when are the timelines for this assessment will happen. We also have the resources for teachers as well. We also have general fact sheets for local stakeholders in this website. Now, the Assessment Bureau newsletter is a weekly newsletter that we provide to your district desk coordinators. We have key dates, their ordering of materials, any types of communication that falls under Assessment Bureau is being communicated there. Easy to sign in this newsletter. You have a QR code here. Feel free to put your name so that at least you'll see what are those announcements that we provide for the newsletter. Now, this is the one that I did also mention to you a while ago. When you appoint your DTC, they will have access to the DTC Canvas workspace. We have the monthly DTC checklist being provided there, a secure vendor portal, and help desk numbers. Manuals and forms will also be available in the DTC workspace. The last resource that I would like to discuss is the test coordinator portal. This is a very important portal where your DTC will submit irregularities. If you have one during assessment, please note the irregularities that needs to be submitted aside from a MIRA will be all end of the year state assessment. And then we put for the test coordinator portal, we have also the medical exemption form requests, their non-standard accommodation request, and domain exemption request for your access. Now, assessment program cost. So charter leaders, pretty much as you go on to your school year, you'll see your student demographics, student groups, and then you can easily assess how much will each group will cost LEA for those assessments. So for access for the EL students, grades K to 12 under WIDA, you have the LEA cost per assessment there, $18 per computer administration and $20 per paper administration. And then for alternate access for ELs, that's going to be $70. And then for ASR, if it's a computer administration, it's going to be $16.50. And then for paper administration, that's going to be $21.50. Please note, this is the current for this school year, which is applicable by the end of by May of 2026. If there will be a change in terms of the assessment cost, we'll be releasing another assessment cost for 26-27.
Neil, I have a question about the cost.
Sure.
Does that will we have that money in our budget to pay for that? Do you send us a PO? How does this piece work?
So each vendor has a program, but this is the general idea on how I understand the PO. The vendor will communicate directly to the school regarding their POs. Like for example, KU, which is the University of Kansas, they will send you guys a PO, whoever you assign to that will be receiving that. And if you like, for example, it's almost at the end of the year and here comes a budget, the deadline for my budget, I haven't received a PO yet. Don't hesitate to reach out to us, like the staff assigned for the assessment specialist, and we will be happy to assist you connecting you to our vendor platforms.
Thank you.
You're welcome. Now, what are the fully funded by PED? So these are the things that you don't need to pay for anything. So the New Mexico, the MASA grades 3 to 8, you don't need to pay for that, including the IMASA. Am I correct with that, Alice? The IMASA is also fully free. The DLM alternate assessment grades 3 to 8 and 11 are fully free as well. SAT school day grade 11 is free. If you ask me about SAT school day grade, no, SAT grade 10 assessment or PSAT, I'm not sure what's the latest cost for that. But feel free to reach out to our what do you call this point of contact in terms of assessment.
It's
And I know
funded, Neil. It's down
it's full.
below.
Oh, there you go. Thank you.
Yeah.
And then the other fully funded that we have is the SBA Advanced Stomp. The Amira iStation K to 3 is also fully funded. And then the CCS STEM Ready Aligned Formative Assessment for ELA and science and math as well are also fully funded. The assessment literacy training in person and virtual, you don't have to pay for those trainings that we had. Those are fully funded by PED. All right, so let's talk about the National Assessment of Educational Progress. This is one of my main assessment that I handle under assessment. So I'm your NAEP state coordinator for New Mexico. So you already probably know about NAEP. NAEP is the federal required assessment to administer to all sampled schools and students within the 50 states, including all jurisdictions of District of Columbia, Puerto Rico, Department of Defense schools. And then technically right now we're undergoing the main NAEP assessment happening for 2026. Now the main question is, I know not a lot questions are coming from the Charter Schools Bureau. What if we decline? What will happen to us? So technically we touched base with legal department of PED last time. Since the if one of the sampled school in the state will not participate, the Department of Education has the power to take away our Title I money as a state. So the state will be taking away your Title I money and together with other funds that you have as a charter school. And then if you have any questions, concerns regarding on how to complete the pre-assessment task, how to make sure that the NAEP assessment will still happen in your school, don't hesitate to reach out to me. We do have a couple of changes happening in terms of NAEP. In the previous years, NAEP is being provided using paper-based assessment, and they just switched to computer-based. And now from NAEP devices, we're switching to school devices. So when you get selected on either school year 2028 or 2029 for NAEP, or even with the long-term trend, we might be using a school device during that time. Not a final set yet in terms of the school device, but I will communicate that to you if you are going to be selected as a sample school. The other assessment I handle is the Early Development Instrument, or EDI, and Childhood Experience Questionnaire, or CHEck. So this to replace, the EDI replaced the KOT that we had. Both are actually surveys being given to different stakeholders. For the EDI, the one completing this is your kindergarten teacher, while your check are parents of your kindergarten students. So we get two set of points that once you complete this, we provide the data to you by the end of the school year. Please note that check is not a mandatory parent survey, but we would like to have their inputs for this assessment. So we always encourage the kindergarten parents to complete the survey. And at the bottom of this this slide, you'll see links where you can find more details regarding the EDI check and then the professional letters for the EDI check. All right.
Okay, Neil, I'm going to take over. Thank you, charter leaders. If you haven't noticed, I went ahead and posted the assessment overview slides in the chat, so you can have access to all of the links and all of the information. I'm going to continue with an overview of our assessments. So starting with Access for ELs, this is our English language proficiency assessment that's administered to all students in K-12 who have been identified as ELL students. There are 4 domains. There's a reading, writing, listening, and speaking. And this is administered yearly, usually around this time, January, February time of the year. And it's usually administered as either a one-on-one or in a small group setting. The next assessment is Avant. The assessment is actually called Avant Stamp. The vendor is Avant. This is only for LEAs that have a bilingual multicultural education program. And this is our Spanish language proficiency assessment. And again, this is for all students in the LEA that are part of the program. And this is administered annually as well. Both for Access and Avant, students can achieve a proficiency score that allows them to test out of the assessment, so they would not have to take it for the next year. Next is Amira Learning. This is formerly known as iStation. There's the ISIP, Indicators of Student Progress, ISIP Lectura, ISIP Math, and this is for students in grades K through 2. It's required beginning, middle, and end of the year. It's also available for other grades, but it's required for K through 2. And this is our early literacy assessment. Next is NMASR that Neil referred to earlier. This is one of the assessments that that has a cost charge to the LEA. This is the General Education Assessment for Science, and it's required for students in grades 5, 8, and 11. That school day is required for all students in grade 11, except for students with most significant cognitive disabilities who would take the alternate assessment, which I'll talk about in the next couple of slides. NMASA, it's pronounced Masa. You might hear it Mesa, Misa, I don't know what. Masa, you can remember from what tortillas are made from. That's how the vendor pronounces it, and it's their test, so I take their word for it. This is one of the assessments that I'm responsible for, and it's our general education assessment for students in grades 3 through 8 for language arts and math. And the testing window usually is from beginning of March all the way through like the beginning of May. And there's a Spanish version of the assessment available as well. IMASA is also from our vendors called Cognia. It's the same vendor that has NMASA. The interim assessment, you're required to participate in an interim assessment. It does not have to be IMASA, but IMASA is fully funded by the NMPED. And it's required for beginning of the year, middle of the year, end of the year. If you choose to use a different interim assessment, you are not required to send your results to the NMPED. And it's all outlined in the memorandum that's linked in the slides. Spanish SBA. This is for students who qualify in grade 11 who are English language learners can participate in the paper-based Spanish SBA in lieu of SAT School Day language arts. Very, very few students in the state participate in Spanish SBA. Last year we had around 200 students. Most students participate in the full SAT School Day test. Dynamic learning maps. This is one of the other assessments that I'm responsible for. This is our assessment, alternate assessment for students with the most significant cognitive disabilities that have it designated in their IEP. This, again, is not as rare as Spanish SBA, but last year we had roughly 1,800 students participate in this assessment. So it's a relatively small number. And the link that is linked here to most significant cognitive disabilities will give you the definition, the state definition, so you can present that to your IEP teams. DLM has a separate set of performance standards. They're called essential elements. They're linked with Common Core state standards, but they're a different set of standards. So those standards also need to be used in classroom instruction before the students participate in the dynamic learning maps assessment. Neil referenced earlier assessment literacy. It's knowing all about assessments, how to design them, how they work, how to analyze data, what are the three types, formative, interim, summative. We have an entire web page devoted to assessment literacy, and we also offer various trainings throughout the school year. Some additional resources that you can take a look at that are going to be for your DTCs. Assessment cost is also linked here, as well as the federal testing requirements that Neil addressed earlier. And our contact list. It's best if you have a question about a specific assessment to contact the specific person. You'll get a faster response than if you use the email for general questions. You'll get a much faster response if you contact the assessment specialist directly. And that's the end of our presentation.
Alice, let me highlight
Sure.
your last comment.
Of course.
So pretty much, let me just explain the process to you, new charter leaders. All the assessment specialists right now listed here are very equipped and knowledgeable about their assessments, and will be able to provide your question. I'll answer your questions within 24 to 48 hours. So it's a lot better rather than sending an email to PED assessment and then asking where will I find the assessment cost for ASR? Just email Mireya Gonzalez for ASR. And then you ask, am I part of the CSI MRI school? Will I take IMASA for that? Just email Alice Banks for that. Neil, am I part of the NAEP sample list for 2028? Just email me rather than asking those general questions to the PED assessment email. It's a lot faster. There's only one person navigating coming from that or handling that email, and there's a bunch of emails going there. So sometimes it takes like a week before we receive the communication and before we respond back to you.
There is one more thing about this contact list. You'll note that there's not an assessment specialist for SAT School Day for College Board. We have a new person that is going to be starting with us next week. So in the meantime, and this will be updated, so in the meantime, if you have any questions regarding SAT School Day or PSAT, you can send those to the PED assessment email.
All right, thank you guys. Does anybody have any questions for this group? So you can see that it'd be another good reason to choose the NMASA as if you're going to choose option 2, because you're already going to have to do it as an interim assessment. So.
Yeah, one thing about that, Missy, is a good thing if you choose IMASA as your interim, your students will get used to the portal, how it looks, how, we're not pushing it either way, but that's another one of the advantages. So when they do take NMASA in the spring, they're accustomed to the portal and the tools that are available.
Yeah. Well, Allison, I don't know if you guys know, but the commission has created a new performance framework in which they are going to let schools make a choice for their academics, and how they're going to be evaluated by the authorizer. So they would still take the statewide assessment, but they can say that they will do an interim assessment, and they can provide that data to help bolster. So like, if they're not quite meeting the statewide assessment goals, but their interim assessment data shows in a very complicated, complex way that their kids are making progress towards proficiency or growth, it can help move them from a working to meet to a meet standards, or from even a meet standards to an exceed standards. So thank you guys so much. That was very helpful, I hope. Does anybody have any questions? Or, I mean, you know who to contact. Yeah.
I do. Just are both masa and IMASA in Spanish?
Good morning. This is Kathy
The-
from Marissa.
oh,
Hi, everybody. How are you?
Hold on one second. Kathy, can I answer Julia's question? I don't know if you heard her ask her question,
Yeah.
or if you just got on.
For Kaylee and Martha, if they're coming on?
They're on the prior presentation, Kathy.
Oh, there.
Yeah,
Oh,
we're still
hi,
on
Kaylee. There's
we're
Kaylee.
still in the prior, so go ahead, Alice.
Okay, sorry about that. So Julia, to answer your question, IMASA is not available in Spanish for language arts. It is available in Spanish for math. So if you have a student who is an EL student that is like a newcomer, like year one student, they can take the Access, which is the English language proficiency, in lieu of the IMASA. They don't have to, or they can attempt the IMASA in English with accommodations, like with a picture dictionary, word-to-word dictionary, or they can use Access in place of those assessments, because it's not offered in Spanish for language arts.
Great, thank you. And the
course.
masa is right in both Spanish and
Yes.
English. Okay.
Yes,
Great. Thank you.
of course.
Thank you, Alice.
All right, thank you, Neil, and assessment team. So we really appreciate you taking the time to work with our new LEAs. All right, and we have,
Best of luck to you all. Thank you.
thank you so much.
Good luck, everyone.
We have
Bye.
Bye-bye.
Thank you.
our NIPSIA group here. All right, so we had Maggie Dodd had to leave real quick, and she'll be back soon. Okay, and then Neil was just putting in IMASA. All right, so welcome to the NIPSIA team. We have 3 potential new schools this year. We've got Collins Lake Outdoor School up in Mora, Inspira STEAM Academy down in Las Cruces, and Equip Academy of New Mexico in Albuquerque. So look forward to, they're all very much interested in hearing what you all have to say. So take it
Good
away.
morning. Thank you, Missy. Thank you, Mr. Farnas, for scheduling us to be part of this agenda. We do always appreciate the opportunity to get out in front of new charter schools, and hopefully, if nothing else, introduce ourselves as a resource to you all. My name is Kaylee Jones. I am the benefits manager with the New Mexico Public Schools Insurance Authority. We also go by NIPSIA occasionally, if you're not familiar with the acronym. Today with me, I also have Miss Kathy Payanes. She is the Vice President and Account Supervisor for ERISA Administrative Services. ERISA is our third-party administrator, and so just as closely as you'll be working with NIPSIA, you will also be working with our TPA. Okay. I'd also like to introduce Leslie Martinez. She is NIPSIA staff that is also on our call. Again, that's going to be another familiar name that you see coming through your email, as she is a really great resource for all of our participating groups and keeping them up to date on the latest and greatest happening throughout the agency. Mr. Farnaz, will you be sharing the presentation, or should I go ahead and pull it up?
You can go ahead and pull it up and share screen.
Okay. Sorry, everybody. Give me just a moment here.
Hopefully you have access.
Let's see what it tells me.
Yep.
Wonderful. Thank you, guys. Put it in full screen. All right. So moving on, just a little bit of an overview about our agency. NIPSIA is a state agency created in 1986 by the legislature, and we provide group health insurance and risk-related coverage. New Mexico charter schools are mandated to carry these coverages. Our revenues are derived from other state funds, and claims are paid dollar for dollar with the premiums that we collect on a monthly basis. We do procure a number of benefit-related services with groups across the state of New Mexico, such as Albuquerque Public Schools, State of New Mexico Healthcare Authority, as well as the Retiree Healthcare Authority. And really the purpose behind that partnership is that way we can secure more competitive pricing for our school groups and the groups that we insure. Talking a little bit about what NIPSIA looks like today, we insure 88 mandatory school districts and 102, soon to be 105 mandatory charter schools, as well as 28 other voluntary groups, such as educational entities like the colleges and others as well. As of January 1st, our approximate membership is just over 79,000 lives. Our agency is staffed by 12 full-time employees, and we are governed by an 11-member board of directors. The board is comprised of governor appointees, New Mexico Association of School Board Business Officials, members of Public Education Commission, School Board Association, the Superintendent's Association, NEA, AFT, and other educational entities at large. So all that to say is I do feel we have a very diverse board whose interest is solely to make sure that the entities that they represent are, those voices are represented on our board. All right. So getting into what implementation looks like as a new charter school with NIPSIA benefits. My job here today is really to answer, how does your group go about becoming a member of NIPSIA benefits? So the process is really started by PED initiating. They notify New Mexico Public Schools Insurance Authority of any new groups. This notification is typically inclusive of an effective date. So if representation from each of the three groups can just unmute and share with me, again, the name of who you're representing and then the effective date that your charter will be in place.
Inspira STEAM Academy, so like inspire, but with an A at the end. Down in Las Cruces, we will be open July 27, 2026.
7/27 of 26. Okay. Thank you.
Yes,
Yeah,
ma'am.
so these three schools should all be entities starting July 1, if they're approved by the commission. So
I got
I'm going to come in and speak for one of the schools because they're not here. And they are Equip Academy of New Mexico, and they will be in Albuquerque. And
Okay.
again, I don't know when their official opening date is, but as of July 1, 2026, they should be an entity in LEA.
Okay.
They're opening in August.
They're going to open in August. Thanks.
And then, yeah, we're the last one, Collins Lake Outdoor School. And yeah, I think we're opening in, our school starts in early August. But again, July 1 is when we'll be official, hopefully.
Okay. Okay, I appreciate that. There's just some nuances between, when the school is approved, and then really what NIPSIA cares about is when are you going to be offering employees benefits coverages. So these dates, even though, we're getting approved hopefully tentatively in July, start dates of August are going to help us paint a better picture of when employees are going to be needing benefit coverages to be effective. So thank you very much for taking the time to kind of participate in this little training. From there, once, PED has already notified us, from there, you will be receiving a benefits election form as well as a required contact form. These do come from our third-party administrator, and really the benefits election form is going to require each group to make decisions regarding what coverages they plan to provide to their employees. I'm going to go over in more detail today exactly what those optional benefits are, and hopefully help you make a more educated decision regarding which you would like to opt in or out of. The second form is going to be the contact form, and so this is so that way we can collect details about the school, including mailing and physical addresses. We also will need to know who from the group is considered the head administrator and which of those employees are going to be authorized to administer health and risk benefits for the different employees. We also want to know who's on your billing and payroll system, or team, I should say. That way we can incorporate, direct communications to the appropriate personnel. And then lastly, on that form, we collect information regarding your group's IT department. We want to make sure that we are working directly with them to navigate firewalls, whitelisting of our domains. That way we can communicate not only with you, but also your employees effectively. We do ask that, the form, the election form, as well as the contact form is completed in its entirety. That way we have all the information at once. I'd also like to touch on the third kind of component that you're seeing on the screen. Our third-party administrator will get the group set up in our database and initiate the process with each of our carriers, so that way they can begin receiving files recognizing your employees and their association with you as NPSIA eligible, benefits eligible employees. We will work closely with you, and in addition to ERISA staff, to support you with training. We want to make sure that we're coordinating not only with HR staff, but with all employees to help them be educated in the benefits that they will soon have available to them. And then the last blue box there, NPSIA will bring the request to implement the new group to our governing board for approval. This is really just a best practice. As I mentioned before, charter schools are mandated into coverage per our statute, but this is our way of making sure open communication with our board is taking place as well. Now, towards the bottom of the screen, you'll see some decisions for the new charter school to be made. Starting off with number one, we're going to talk more about the effective date that you're looking to make the benefits available to your employees. We do also want to be cognizant of the time needed for appropriate premium collection from the charter as well as the employee. The second one here is outside mandated basic life and medical coverages. What other benefits are you looking to offer? We'll also want to determine whether or not you wish to offer domestic partner coverage. So right now, eligible dependents are named as a spouse. For the employees who may not be legally married but have a domestic partner, we do extend coverages so long as the employer does wish to do that. And so we're more than happy to walk you through that process as well if that's something you're interested in. Number 4 is elect a part-time resolution to allow employees working less than 20 hours per week, but not less than 15 hours per week to be eligible in other lines of coverage besides basic life insurance. So kind of as a signing incentive, some schools do wish to extend benefit offerings to their part-time employees. And so if that's something that you guys are interested in, we will be helping you with getting that set up as well. Last but not least, we want to know whether or not you intend to offer an alternate premium contribution schedule. So further on in the presentation, I'm going to be going through what our statutory tiers are, but it is up to the employer whether they wish to contribute above and beyond those tiers. And so with that, I want to go ahead and get into more of what all of this really means. Do I have any questions so far? Again, I'm going to elaborate more, but does this sound like a good game plan? I see some nodding. Okay, sounds good. So here on this next slide, this is really just a summary page of the NPSIA benefit offerings. I'm going to be touching more on each of these further along in the call. Starting off with medical, I'll jump to this slide here. On medical, we contract with 2 carriers. These carriers are Presbyterian and Blue Cross Blue Shield. Each carrier offers a high and low option plan. The plan design is largely the same regardless of the carrier selection. When employees consider which carrier to select, it's really coming down to 2 factors. The first of these factors is the cost of the premium that's paid on a monthly basis. So just general information, Presbyterian premium is a little bit lower than what employees would be paying on if they elect Blue Cross Blue Shield. The second factor that comes into play when choosing their carrier is the network of providers that they will have access to. Presbyterian has their, specialty network. Blue Cross Blue Shield has their own. Both of these carriers offer nationwide access, so our members, really we don't get a whole lot of complaints about issues surrounding, lack of access. So that's always good to hear on the medical plan. When it comes to electing a plan option, so now we're going to get into the high and low, employees will want to consider really how frequently they're utilizing the benefit. If they're in relatively good health, they may only be going to the doctor for their routine annual checkups. In this case, the low option might be, that might suffice for these individuals. However, it is important to keep in mind that members pay more at the time of service on the low option plan. So any dollars saved in the premium on the low option, employees will really want to be sure to set this aside because they will be contributing to the higher deductible, higher coinsurance, and higher applicable copayments. And so what you're seeing on the screen is kind of, we call it a side-by-side medical comparison chart, but this is so that way members can see by service the dollars that will kind of differentiate the 2 plans. I'm going to go down to our prescription plan design before I stop for questions again. So on the prescription drug benefit, this is included in the medical premium. So as long as the employee is enrolled in medical coverage, they will automatically have access to the benefits carried by CVS Caremark. The election of either the high or low plan on the medical option will impact the employee's placement in a low or high option prescription benefit. So if they are on the high option medical plan, they will be placed on the high option drug benefit and then vice versa for low option. Any questions with how, the prescription benefit plays a role with the medical, or any questions so far?
Kaylee, I just want to say one thing. This is Ted. I know you're trying to get through a lot in an hour, but I want to give you the option that you guys could also have another hour in February or March if you feel like it's too much to get into 1 hour.
That's wonderful to hear. We did kind of restructure our presentation this year for that purpose. We felt it was a little bit too much to go over it at once. And so I'm going to be giving a few different opportunities, but if you want to have us back in, late winter or spring, we would be happy to accommodate that. So okay. I appreciate it. Thank you. Yep. All right, moving along now into wellness. Included in the medical benefit, employees do have access to our robust wellness program. The slides that you're seeing here show some of our more highly utilized benefits, but in all honesty, this is just the tip of the iceberg. All of our programs are designed to support members in their unique health needs, and we want to be sure that it's inclusive of every individual, regardless of where they may be starting on their health journey. As the employer, you are really responsible for developing the culture at your site And so hopefully the goal for all of us is to place value in the importance of self-care and personal betterment with each of our employees. This is a huge kind of step towards retaining the staff that will soon be employed by your charter school. And, you know, NPSIA really wants to come alongside of you to support you as a resource for your employees. We also have a wellness ambassador program. The ambassador program is one way, like I said, that we kind of come along and support you in building that wellness culture within your school site. As you're building your team, you may want to consider designating a wellness ambassador to really take ownership of driving the wellness program in your school. Of course, all the materials, the development of communications, all of that would come from us, but we just really rely on really boots on the ground, familiar faces to be able to share that information with employees as questions or concerns come up. Let's see here. Oops, went a little too fast. Let's see if I can go back. I think it's gonna let me. Let me stop sharing real quick. Sorry, guys. Well, my screen is stuck, but I just wanted to touch base on the Lantern benefit. Lantern is the last kind of benefit I'll touch on related to medical. Lantern is a vendor that we partner with, which is really designed to increase the affordability of musculoskeletal services. So surgeries that involve bones, joints, spine, these services are free to our membership so long as they are using a Lantern network provider. The benefits have gotten very positive member feedback, and I think this is a benefit that really sets NPSIA apart from other large employers throughout the state. So I didn't want to miss speaking to that. On this slide, however, we're going to talk a little bit about dental benefits. NPSIA offers dental plans with 3 different carriers, which you'll see at the top of the screen. These are Blue Care Dental, Delta Dental, and United Concordia. Each of these carriers support our 2 plan options. We have, again, high and low plan options. Similar to the medical plans, each carrier selection is really varied according to the cost of the monthly premium and then the network of dentists that they'll have access to. The dental benefit is an optional offering, so you as the employer can determine whether you would like to extend this to your employees, but most of our employer groups do choose to extend this coverage to employees. All right, next we're going to go into vision. Vision insurance is another optional offering to consider. NPSIA is fully insured on this benefit, and we offer a single plan option with Davis Vision as our single carrier. The coverage is extremely affordable, but really, most importantly that I want to kind of touch on here is the number of chronic diseases and malignancies that can be detected through routine eye exams. And so, although it is optional, we do highly encourage the utilization of the vision benefit for employees. All right, I'm going to get into vision. Any questions as I wrap up the health benefits section of the presentation?
Haley, when you spoke about the bones, are you talking about chiropractic care?
So chiropractic care is included in the standard health benefit. There are, I believe, 60 sessions a year that members can utilize, and the copayment is aligned with the regular office visit. So depending if they choose the high or the low option plan, that's how the copayment will be set. So to answer your question, chiropractic is covered, not necessarily on the Lantern benefit, which I was talking about. The Lantern benefit is specifically for surgeries.
Oh, got it. Okay. Thank you.
No, great question, of course.
So one other quick question for the wellness. So do they pay for, would the policy pay for classes and diet and meditate, just all the kind of different yoga and things like that someone might be interested in, or like a gym membership or?
Yes, I'm so glad that you brought that up. Let me just try and bring up the slide again. I appreciate the questions.
And while you're looking at that, Kaylee, when I had Mitsuya before, because we live in Las Cruces and like the gym providers that are available are not here, is there perhaps a different provider that we can use? I'm sure Steve has the same problem up in Mora. They probably
Yeah,
don't
there's
have a
not much.
defined fitness or one of the ones that are in Santa Fe or Albuquerque.
Yeah, so, okay, I want to kind of take bite size. We'll start with the gym membership. Presbyterian and Blue Cross Blue Shield have gym memberships. So it's a little bit hard for me to sell because there's a lot of nuances on the gym membership. So for people who live in more urban communities, it might be a good option for them because they have access to, like you said, a lot of different gyms. And what the gym membership benefit does is tie in membership to several different gyms without individuals having to pay individualized memberships. So again, it's convenient for urban populations. Gyms, you know, they're getting a cut on their membership fees, and so we do find a lot of gyms who are not willing to participate in this specific program. You know, we've even had members like turned away because the gym itself doesn't want to promote being partnered with the benefit through the insurance. So needless to say, I think for individuals in more rural communities, this probably isn't something that is going to resonate with you just because it's not as accessible as, you know, again, for people who live in Albuquerque. For the charter, you know, Equip in Albuquerque, that might be something that your employees really like to take advantage of. But for the other two, it might not be so feasible.
Excuse me, Kaylee, is there someone that the owner of the gym should be contacting directly to organize that?
Yes, they would. You know, Presbyterian and Blue Cross Blue Shield do solicit the gyms. But if a member themselves is having difficulty with a particular gym not abiding by, you know, what's been represented by either of the carrier, you know, they'll want to let us know because I think it's important that the plan administrator kind of does that administrative work in analyzing the contracts and making sure that, you know, their end of the deal is being held up. And I think that's a little bit better suited to come from us as the plan. So you can always give them my email address if it's a member who's having a particular issue.
Well, it's not a member, it's the owner has been trying to get this because she wants to be able to do that in Santa Fe and has been having trouble doing it. So can I give her your email?
Absolutely, yeah.
Perfect, okay. If it's my gym membership, I would love if it's covered.
Yeah, that's great. Yeah, send her my way. I'm happy to, is it for Presbyterian and Blue Cross or just one or the other?
She wants to do both. She wants to offer both. It's at Hotworks in Santa Fe.
Okay. Yeah, send her my email. I will do some research on my end and get the appropriate contact and do a little handoff.
Okay, thank you.
So, of course, going back to the other question regarding health coaching, you were asking about meditation. Those are included. We have Life on Mindfulness. Right now it's listed under Presbyterian, but this is actually available to all of our members. This is a digital platform that we have. Well, she has a website. We kind of house some of her information on our website. That way, if people happen to be on ipsia.com, they can kind of come across it. But yes, they're live and on demand guided meditations that people can take advantage of. Health coaching, again, through the medical plan, members can, really it's important that they start with the first step, which is getting onto their app or to their website. But each Blue Cross Blue Shield and Presbyterian have dedicated nutritionalists, health coaching. They can get signed up and registered. And again, if you have a particular individual who's looking to take advantage of this, you know, send them our way. We're happy just to send them flyers or, again, help them with the registration process. That way there's no questions, you know, when they're in that process. Does that answer your question, sir?
Yeah, thank you. We've got a nonprofit out here we have a wellness center that we're offering services like these to people in the community, and it seemed like something that if the employees could take of the charter school could take advantage of that'd be great.
Wonderful. I'm really happy to hear that. That's great. Okay, let me go ahead and move back along. We are on the life benefit section now. So again, these are going to be some additional decisions to be made regarding the life benefit. We offer these through the standard. The standard is the carrier name. Offerings through the standard include basic life, additional and dependent life insurance, as well as long-term disability. So basic life insurance is the only benefit that is required to be offered by the employer and paid for by the employer. The employer will choose the benefit level there in the top, in the green text. You will choose the benefit level of either $10,000, $25,000, or $50,000. We do see that more and more employers are moving away from the $10,000 benefit level because, as you can imagine, that amount of money just really doesn't go as far in this economy. You can also elect to offer additional life coverage, but the employer is not required to contribute to this premium. If you can extend the coverage to your employees, again, but you're not required to pay for it unless you would like to. This is great coverage for employees who wish to increase their own life insurance or carry coverage for their dependent or dependent spouse or their children. The text in blue that you're seeing on the screen is available to employees through the basic life benefit. So there are no additional buy-ups required for employees to be able to take advantage of, for instance, that accelerated benefit or the specified disease benefit. We have a life services toolkit where members can go on, get assistance with estate planning, helping with generating a will. All of those logistics that we don't really like to think about. It's important that they are planning ahead, because that's going to help with taking some of the stress off of the family, especially when they're going through the grieving process. So like I said, the text in blue, there's no buy-ups required. That's included in the basic life benefit. But if additional life is something that you're interested in offering to your employees, you're not required to contribute to that premium. The last benefit I'd like to touch on here is the long-term disability coverage. The employer can determine how much, if they are going to be extending lifetime disability to their employees, they can determine how they wish to contribute to the premium. If this is something that you would like to offer, you would need to specify the benefit waiting period of either 30, 60, or 90 days. The benefit waiting period is a timeline of sorts, which dictates when the employee would be eligible to utilize the benefit after a doctor has determined that they are disabled. So this was kind of like a loaded slide. Are there any questions surrounding the life benefit? Alrighty. Moving along, I just wanted to highlight our different logos. Please take notice of these logos. As you get implemented, you're going to see mail and email communication coming from us as well as our administrator. Everything will always be branded with our logos, so that way you know it is legitimate. But also make sure that you're making these logos kind of familiar with your employees, because once they get enrolled in benefits, they will receive mailing communication. And I can tell you, more times than not, employees are throwing away mail, thinking that it's junk or whatever, like the excuse might be, but they are receiving information for a reason, because it has to do with their coverages that they are enrolled in. And so we just need kind of your assistance to make sure that our communications are getting out to the members as appropriate. Moving along, I want to make sure I'm leaving plenty of time for questions at the end. That way, if anything's not getting touched on, we have an opportunity. So apologize if I'm going a little quickly, but I want to make sure I'm leaving some time at the end. This is regarding employer reporting requirements. So we are still a ways away from you being able to actually administer benefits to your group, but this slide is still worth noting even now. I want you guys to keep in mind that when employees make enrollment requests, employers have 2 weeks, 15 days to take action on those requests. Action can mean either accepting the enrollment and passing it along to our administrator, or denying the request. we do owe it to our employees to provide, timely determinations. And so we do rely on each of you to pass along the request along to our administrator in a timely fashion. And the primary purpose of this is that we can avoid any delays to the employee's ability to seek the services that they rely on. So again, as soon as that request comes in from the employee, we ask that you turn that around as quickly as possible, but no later than 15 days. In addition to that, we do understand that charter schools frequently rely on contractors to carry out some of the day-to-day, operations of running a charter school. As it stands today, NIPSIA cannot accept any reporting, processing, certifying, or approving of benefit enrollment. This includes changes of status, terminations, retirements, resignations, even leaves of absences. Any of these requests that are coming from the employee must be approved or acted upon by a designated employee at the charter, not a contractor. I know that this might be a little bit concerning, just considering the workload that you have in implementing a new charter school. Are there any questions or concerns that I can help get answered now that you've been informed of kind of some limitations to the contractors?
Really? So our business manager is not hired. He's not our employee. But he does work and he's our only business manager, and he's the one that would be handling these requests. How does that work?
So in order to actually sign off on, say for instance, an enrollment application or to receive credentials into our online system, they do have to be an employee of the school. So I guess just to outline general information, the individual who is not an employee of the school can be a resource to employees to help them, in making decisions and keeping them kind of on track with different timelines. They can all be a part of that part up until the point where it comes to signing an enrollment application, or again, if it's an online request, they will not have credentials to the online system. So up until that point, they can help with all of that, but the sign off itself will need to come from an employee of the school.
So that would be either myself or the executive assistant.
Yeah, and so I'm just curious, is this for Equip or no?
No, it's for Inspira.
Inspira, okay. Yeah, Kathy is on. To my understanding, it's very black and white that we would not be able to allow that individual to do more than just what I, just explained. But Kathy, is there any nuances that I might have missed or accommodations that we can make for her? If you're still on.
And no, I assume that for almost all the charter schools that the business manager is not an employee. So it sounds like what we need to do is the business manager can do a bunch of the work, and then it just has to be signed off by the head of school probably.
Yeah, so I actually have my assistant business manager in office today, and how we work it is that I make all the changes in NIPSIA, Julia and Steve, and then our business manager definitely has the timelines of when bills are paid. If she can remind me of entries, things like that. So they don't make specific entries, but we work in hand in hand in making sure that the system is updated and we're paying everything on time. So Julia, I definitely don't mind sharing Jerry and Whitney to show you guys how to do that.
That's wonderful, Mr. And I do appreciate you chiming in there. That's exactly the picture I think I was hoping to convey, is working very, very closely with these individuals, but just kind of keeping that margin where sign-offs are coming from a designated individual. Thank you for articulating that much more eloquently. Thank you. Okay, talked about reporting, talked about contractors. We're going to touch a little bit on insurance fraud next. So this is an excerpt from our rules and regulations. We do take fraud very seriously, and there are serious repercussions for members who knowingly misrepresent facts regarding enrollment or eligibility. As for you as the employer, it is imperative that you hold employees accountable for their representations being made. Employers who neglect to prevent the progress of inaccurate enrollment information do risk forfeiting the entire group's ability to participate in NPSIA benefits. So, you know, you're kind of like the gatekeeper. Nothing's gonna come to our administrator without passing through you first. So just keep a watchful eye on, you know, the requests coming through employees. You know these people, you know, to us, their names in a system, but to you, they are, you know, your colleagues and your staff. And so you know these individuals better than we will ever have an opportunity to know them. And so we rely on you to validate those enrollment and eligibility facts that are going to be coming across your desk. Any questions here? All right. Moving along into contributions. So NPSIA will need to collect information surrounding how you as the employer will contribute to the monthly premium. For basic life coverage, the premium is required, again, to be 100% contributed by the employer. As for additional independent life, it is solely the employee's responsibility, again, unless you wish to contribute above and beyond and assist with that contribution. As for all the other lines of coverage, that's medical, dental, and vision, assuming that you are going to be electing all three of those, these other lines of coverage follow a shared contribution schedule. And so, again, you can choose to be more generous here, but the statutory tiers are the baseline requirement. Under the NPSIA statute, employees whose base annual salary is less than $50,000, the employer will contribute 80% of that premium. For employees making between $50,000 and $60,000, the employer contribution is 70%. And then anyone making $60,000 and over, the employer contribution is 60% of that total premium. On the form, as we get more into that form, you'll be able to make known to us whether or not you plan to follow the statutory tiers or if you wish to contribute above and beyond that. On the next slide, it's just a little screenshot of our current rate schedules. Our premium rates are located on the employer tab of our website, and I'll get into more detail about where you can find that. Our rate schedules are approved each spring, and they become effective October 1st of each year. The rates that we have posted now will be valid through September 30th of 2026. So more than likely, from what I heard, you will probably be doing at least 1 month of premium on this current schedule, and then on October 1st, you know, September premium will be collected according to the October 1st new tiers, or excuse me, I should say new schedules. So we'll get into all of that as well. But as far as right now, are there any questions about how the employer premium contributions kind of play a role, or your autonomy in contributing above and beyond those tiers? All right. Moving along, this is a lot of information, right? So I want to give you guys actionable steps. That way you know kind of where you stand at this point. So step number 1 is that you will be receiving a packet shortly after this call from our administrator. It's gonna include the 2 forms that we've already been talking about in this call, which is the new group benefit election form, indicating, you know, which benefit offerings you plan to extend to your employees. And then the second form is the required contact information form, again, which we covered at the beginning of the presentation. So looking at the form that is on the right-hand side of your screen, I'm going to just move down to where it says choose member benefit coverage. You'll see in the gray text, those are the mandated coverages. So basic life and medical, those will be offered to your employees. where you're going to make the determination is, as we talked about, in basic life, whether you would like to offer the $10,000, $25,000, or $50,000 basic life benefit. Moving along down the dental plan, you'll choose whether you wish to extend that coverage, checking yes
Excuse me.
or no. Yes, ma'am.
Sorry, do these have to be approved by the governing board before we make those decisions, or is this something that the business manager and myself decide on?
It's going to have to be your discretion. My assumption is yes, that your governing board would likely want to have a role in this decision. But really, you'll see the bottom of this form, the signature that we're requesting is, not from a board member. It's just from, the head administrator or a decision-making individual. So I guess I can just vaguely say use your discretion as far as how much you want to involve your board. But other charters, do you have experience with whether or not you take this for approval?
I don't have an experience, but it seems like that's something that really needs to be with the board, just because because they're not getting into these benefits, but the employees all are. So it seemed like a little conflict if it's just the employees deciding what they're going to get.
I think it would be best for Julia and the rest of you to kind of discuss this with your business manager and then present what you would like to do to your board. And then, if they have questions, if they disagree, you can deal with it at that time. But that's my
Wonderful.
suggestion.
Thank you guys for chiming in. Okay, so dental, vision, long-term disability, all of these are optional. You'll just simply check yes or no if you plan to offer these benefits. Same with additional life. Now, domestic partner coverage, we briefly touched on it. Domestic partner coverage, there's a different set of supportive documentation that's collected when processing this enrollment. So if domestic partner coverage is something that you're interested in offering, you'll just want to be sure that you are well informed of the different guidelines surrounding the enrollment of those individuals, as well as completing imputed income reporting. So imputed income is basically the additional benefit that the employee is gaining by ensuring an individual who's not technically considered a dependent under the IRS. And so there's a little bit more administrative work that goes behind offering domestic partner coverage. Again, NPSIA and ERISA staff will be alongside of you to make sure that you are informed but also compliant with those requirements, but just something to think about here in the early stages. Part-time resolution coverage, again, we kind of touched on the fact that eligible employees must work 20 hours or more per week to qualify for the other lines of coverage, medical, dental, vision. If you wish to extend coverages to your part-time employees, you'll go ahead and indicate it here. We will supply you with a template, and that will need to go for board approval. That'll get signed off by your board, and then we will take that to our board for approval if you wish to extend benefits to the part-time employees. The bottom section of the form is where you will tell us whether or not you plan to follow the NPSIA 3-tier contribution premium schedule, or if you're going to be offering an alternate contribution schedule. If that bottom row is checked yes, we will collect more information from you as far as what those parameters are going to be specifically. And then, of course, I don't want to go over it too much, but the required contact information form, I touched on it earlier, but we are just going to be collecting, information surrounding where you guys are located, where you would like your mail to be sent to, who's the head administrator or the main contact, who's going to be in charge of billing, benefits, LOA, and risk, as well as workers' compensation. If you have designated personnel for all of those different kind of duties, we want to make sure we're talking to the appropriate people and not leaving anybody out. And then the last field there is the IT contact, as we already covered. Okay.
This is a real simple question, and it's probably obvious, but starting off, we might not want to offer as generous as benefits until we kind of see what our finances look like, and as we grow, I assume we can always, like part-time people, we could start adding them in the future.
Yes. So for any of these benefits, what you start off with offering, you can amend it. For part-time resolutions, in particular, we do collect these on an annual basis. So for schools who did not offer it the prior school year, around March, April, we start soliciting the schools. Hey, would you like to participate this year? And so we start asking in the spring, and then we take it to our board in June, if I'm not mistaken. So June of every year, you'll have an opportunity to kind of, well, in the spring of every year, you'll have an opportunity to kind of reconsider what you plan to offer for the upcoming school year. And part-time resolution is really the only one that has condensed timelines where, we do our best to reach out to you at the appropriate time. These other ones, if you don't offer vision, for example, starting off, but then later decide you would like to, that can take place at any time of year. We would just need, the appropriate time to get it implemented on our side. So, please don't come to us on March 3rd and want it effective April 1st, but we'll do what we can to get those added throughout the year as able. Any other questions on step 1? Okay. In addition to the benefit packet, again, that you'll be receiving after this call, you'll also be receiving a welcome packet from our risk coordinator, Dominique Williams. She's going to be your point of contact for the risk portion of the implementation. We didn't have time to go over that side of things today, but really, Dominique, do you want to go ahead and just introduce yourself, provide your contact information now?
Yeah, absolutely. Thanks to Kaylee. Hi, everybody. As Kaylee mentioned, I'm the risk coordinator with NIMSIA. My name's Dominique Williams. You will be getting a welcome packet that will kind of explain all of the risk carriers that NIMSIA partners with. And what services that they provide. If you have any questions about any of those services, or if you have questions about how to get signed up with any of those, I'll be your main point of contact. I'll drop my information in the chat, but just so you know, if you don't pick it up now, it will be included in the contact information in the welcome packet that you get. But yeah, feel free to reach out to me at any point in time if you have any questions or need assistance getting set up with any of the risk services.
Thank you, Dominique. Okay, moving along to step 2. How are we on time? We have about 10 minutes left. All right, so step number 2 is going to be scheduling a NIPSIA benefits administration training. Really, this presentation is just an introduction to getting you implemented, okay? There's so much more information regarding benefits administration than we can even cover in an hour. And so we want to really just open the door to having more conversations, further conversations regarding benefits enrollment. So step number 2 is to visit our website. I'm also happy to just provide you the link directly when you get the packet materials. You will want to go ahead and make a request, coordinate the time with all benefits, payroll, HR staff, your office manager, whether they're a contractor or not, they should be on this call. That way we can, introduce the team, but also we're going to go over rules of eligibility, introduce you all to the online benefit system, which is where all of the enrollment requests kind of get fed through. We'll provide you with a calendar of important dates and timelines that, recur throughout the year, because we want to be a resource to you all. So please make sure that you are prioritizing getting this additional training on the books. Okay, so I'm happy to be your point of contact in the meantime, but Leslie Martinez, the analyst that I introduced you all to earlier, she really is taking charge of making sure that the different groups that we support have the trainings that they need, because we know more times than not, individuals are kind of thrown into these positions. And so it's in the employee's best interest that we all know what we're doing, and it helps us to be able to do our job efficiently. So that's why I'm promoting our benefits and administration training so heavily. The next training that you're going to want to go ahead and set up is for your staff. And I went too far again. Okay. So the staff orientation, it's a single survey, but in the survey we collect what kind of training you wish to request. And so we ask that you invite us to speak to your employees. We firmly believe that a well-informed employee is a smart consumer of their health benefits. And so, some of these individuals may be coming from a NPSIA participating group and they might be familiar with their insurance, but we don't want to assume everybody does. And, honestly, insurance is pretty complex, so we can always use a reminder. So as you schedule your staff orientations, your onboarding meetings, we ask this to be part of it. We really just need like 45 minutes to an hour to be able to go over the plan design, the wellness offerings, and then more importantly, how to get in contact with us should they need help with, claims issues or a gym membership issue. Any of those sort of things, we want to be able to support them in that as well. The last thing that we'll cover also in the staff orientation is helping them get familiar with the online system. The online system has capabilities for employer, but it also has a separate site for employees. And so really the more that they can do themselves on the online system, the more it gets taken off of your plate. And so we want to be able to place the onus on the employees to really take charge of their health insurance. Questions about these two trainings? All right. Step number 4, just explore our website. We have an employers tab, which is really going to be able to go into greater detail of where we're going with promoting these trainings and just things to keep on top of mind as you're implementing the new charter. So I've circled some things here to kind of prompt you to click on. We have the employers tab, the contact us button. If you or your employees have really any questions at all, go to the website. We monitor this every single day. You'll be getting a response from us, within the hour in most cases. So this is the best way to get a hold of us should you or your employees need anything. I'd also like to point out here the program guide. This is our Bible, right? This has all of our rules of eligibility, our enrollment guidelines. It has summaries of the benefit offerings. And so this is a resource that you're going to want to make sure you get into each of your employees' hands as well. Training tutorials, we'll get into more of this after we schedule your admin training. But this is a resource that you can access at any time with tutorials, videos, presentations for different enrollment and eligibility kind of topics. So if you have questions about forms, we have a whole training module dedicated to completing forms effectively. Yeah, a great resource. Everything's in one place. That way you guys can visit it and just become familiar. But again, this is here for individuals who are more experienced. We do not expect you to learn everything by going in here on your own. So again, the admin training is going to cover the majority of what you'll find on this page, but that way you have more of that face-to-face interaction and you're able to ask questions and it's just more effective that way. This is our contact information for ERISA Administrative Services. Should you need anything enrollment, billing, premium collection related, this is going to be your point of contact there. And Ted does have this deck, so I'm thinking that he'll be sharing it with you guys shortly after this presentation. And then this one is our contact information. So if you or employees have questions regarding the carriers, claims matters, bills that you're receiving from your doctor, you can always contact us. And like I said, we will be happy to facilitate that administrative follow-up with the carriers. That way it relieves it from your plate. All right, I have 4 minutes, not quite as much time as I wanted to leave for questions, but I think a lot of people asked questions as we were going. So the floor is yours. What's missing? What can I help answer in these last few minutes?
Kylie, I'm really excited that you guys will show the employees. I've been teaching for over 20 years in New Mexico and I've never had this training. So I'm super happy that as an admin, I'll be able to offer this to the teachers and to the employees because this is a lot. It's a lot of
Yeah.
information and none of the business managers that I've ever worked with can translate this into human language. So,
Yeah.
so it's
No,
exciting. Thank you.
I'm happy to hear that. And yeah, anytime you have an opportunity for us to get out in front of your employees, yeah, don't feel like you have to memorize everything to convey to them. We are happy to come and do that for you. So
You're invited.
wonderful. I'll get your email.
Okay.
Thank you. Anybody else? All right. I hope you guys don't have too much more lecture time ahead of you, but enjoy the rest of your Monday. I'm going to just put my email in the chat. That way you can jot it down, and communications will be coming your way shortly. So thank you, everybody, for your time. Thank you, Ted, for having us.
Thank you, NIPSIA
Thank you,
team.
Kaylee. That was great.
Thank you, everybody. Have a good day.
I think everyone needs a 5-minute bathroom break.
Yeah,
So Christopher, is it okay for you to start at 11:05?
Absolutely.
Oh, thank you, sir. Okay, we'll do that then.
I will pause the recording. Recording. There we go. So Ted, do you want to introduce our next speaker?
Sure. I'm not sure why my camera's doing this, but I'm over here. So Christopher Vian is joining us from ML to talk about MLSS. Christopher, we have 3 implementation year schools on. We have Inspira STEAM Academy, Collins Lake Outdoor School. Inspira's in Las Cruces, Collins is in Mora, and then Equip Academy in Albuquerque. And should everything go according to plan, they'll all be opening fall of 2026.
Fantastic. So good morning, everybody. Thank you for letting me join. My name is Christopher Vian. Like was mentioned, I'm the Education Administrator for Multi-Layered Systems of Support and Gifted Education here in New Mexico. I'm also over the Student Assistance Team process. So today I'm going to do a very high-level overview of MLSS and a very high-level overview of Gifted so that you can kind of see what the requirements are for our schools. So let me share my screen with y'all. I see a couple of people who I know here and they know how I like to run my trainings, but for those of you who have not met me before, I would much rather us be able to answer questions, have actual conversations than get through a slide deck that you're going to get anyways. So at any point that you know, have questions, have confusion, anything like that, feel free to come off mute and just say, "Hey, Chris," then let me know what's going on. So can I get a thumbs up if everybody can see my screen? Awesome. Thank you, Neely. All right, so we're going to start with multi-layered systems of support. So MLSS is a framework for how to provide all student support within the general education classroom. It is proactive and preventative, which means we're seeking to address concerns before they come up, as well as in response to data. And the big difference between previous systems is that MLSS focuses not just on the academic side of things, but also on the social, emotional, and behavioral side of things. So we're really looking at how we can provide those supports in the general education classroom for both academics and social emotional needs, because there is a connection between the two. For instance, if you have a student who struggles to read and you ask them to read in class, usually they'll immediately raise their hand and ask, "Can I go to the bathroom?" or engage in some sort of disruptive behavior. Whereas if we have students who have been in some sort of conflict with family at the beginning of the school day, it's very difficult for them to learn, right? So there is a direct connection between sort of students' social emotional well-being and learning. So this process, this framework is meant to kind of infuse all parts of the education process. What's really important to note here is this is not a curriculum, right? Curriculum has a place within MLSS, but MLSS is kind of expanded beyond those curriculum options. I am always a huge proponent of people knowing what's in policy. So if you have the opportunity or would like to read the NMEC, New Mexico Administrative Code for MLSS, that's 62919. I believe it's particularly subsection E that deals with MLSS. I know policy language can be a little bit difficult to read, a little bit tedious at times, so I've pulled out all of the required components for MLSS here. So all students are able to receive layers 1, 2, and 3 supports and intervention at any point without the need to convene a SAT team or a referral to special education. So this means that they can receive any level or any layer of intensive intervention based on the data that we find in the classroom, right? And that might seem to be a big shift from this idea that we have to have an IEP or a 504, right, in order to get some of these interventions, when in fact we don't. At any layer, families can request evaluation to determine whether or not a child has a disability, right? So parents can request at any point. Teachers can request at any point as long as they have the data to back it up. We don't just want teachers to go, oh, I think this kid has autism, or oh, I think this kid has a speech language issue, right? We want them to have specific data from the interventions and assessments that they're doing in the classroom, right? So while parents can come up and say, I have a general feeling and begin the evaluation process, we really want teachers to have data before that. There is a tool called the MLSS self-assessment, which is part of the 90-day plan, right? That DASH plan that all schools have to do, that needs to be completed annually. And this is a self-evaluation that works on a 1 to 4 scale where schools are really ranking themselves on about 40 to 45 different indicators. And we'll go kind of in depth in what that looks like here in just a second. And then all schools have to have embedded intervention time throughout the day. What that embedded intervention time looks like, we don't care as long as it happens during the day. If you only have before and after school intervention, that becomes an equity issue because not all of our students have transportation and are able to attend. So we really want to make sure that all of our kids have access to the supports and interventions that they need. So that was a lot of information that I threw at you in like 6 minutes. So what kind of questions are we having? What kind of thoughts are we having? What supports do you feel like you will need?
We haven't opened yet, so we don't know what type of supports we will need.
Okay, so it's really going to depend, how you implement this will depend on where your focus is. So for instance, Dream, Danae, and Deep have very land-based charters. So a lot of their MLSS is focused on how to incorporate place-based interventions into their general education classrooms, right? Whereas a school that is kind of like Monte del Sol, for example, they're really focused on the sort of academic portion, right? Really ensuring that English language learners are getting the supports that they need. So you can really tailor the MLSS process and framework to meet the specific needs. And in fact, that's the goal of MLSS, is really tailoring to that. So as you're kind of working through the opening process and working with your teachers, you'll really want them to think about how to use your specific areas of focus in order to create that MLSS process. One of the good things about MLSS is because it's a framework, it can be adapted. So for instance, oh my goodness, I forgot the Montessori school that just opened up in Santa Fe. They're able to use the MLSS process in very similar ways to even like private schools like Albuquerque Academy and things like that because of how flexible it is. So, Kat, question?
Hi, Chris. How are you?
Good. How are you?
Good, long time no see. So I guess two-part question, and I was thinking about this after our meetings in Penasco back in the day.
Mhm.
Any chance to pre-schedule for our PD with the teachers that are coming in, because like Julia, we're not open yet, but we have
Mhm.
some intense PD in July. And then I'm wondering if there's some type of like PD for parents. So you mentioned parents are like, oh, I think they're on the spectrum, or I think they're this,
Mhm.
or I think they're this. Maybe like discovery night or an informational night for parents that the state can come in and maybe even partner with other schools and have a
Yeah.
nice forum.
So in terms of professional development around MLSS and gifted and the SAT process, any training you want, you just email me and we set up dates. And the great thing about me working for the PED is it is free. So the only thing that I will ask you is like, what's a good restaurant around you? It's one of the benefits of getting to travel across the state. I am more than happy to come in person. I am more than happy to do online trainings. In fact, after we get done here today, I'm driving to Cuba to do a training for them. So you'll get my contact information at the end of this. Just send me an email and we can start planning whatever trainings you would like. In terms of parent supports, I am more than happy, particularly around gifted in the MLSS process, to work with you to create kind of a parent training. In fact, I met with APS's Albuquerque Public Schools gifted parent group earlier last week. In terms, though, of special education, we would want to reach out to our special education department, and I'm more than happy to help facilitate that, collaborate with that in any way. But I would definitely want to make sure that we're looping them in and having them kind of lead that process just because we want to make sure that all of our bases are covered when it comes to things like IDEA and getting out that correct information. But whatever y'all need, y'all just email me and I'm more than happy to help. Other questions about this in this general area? Well, you might get more questions when I actually explain to you how MLSS works, right? So when we're thinking about MLSS, there's really two key factors here. The first is that all students are considered general education students first, right? Regardless of disability status, regardless of if they're English language learners, right? According to the state of New Mexico, all students have the right to grade level appropriate standards-based education. And MLSS really allows us to do that. The second reason why has to do with teachers. So MLSS really only functions when our classroom teachers are considered experts, right? They're considered knowledgeable professionals because most of the decision-making processes in MLSS around supports and interventions come directly from the classroom teacher. So one of the things in the trainings that I've done over the past 3 years is there's been a lot of focus on how to do data analysis. So thinking about professional development, that might be one area that your teachers need support on, right? The data analysis portion, the portion for how to run things like data teams or PLCs. Also making sure there's alignment between curriculum that we use and the New Mexico standards. So some of our charter schools, I'm thinking particularly of like Red River Valley Charter, have had to do a lot of work with aligning their particular curriculum, their particular model with the New Mexico instructional scope, because there's a bit of a disconnect between the particular model they use and how the state interprets standards. That is work that I'm more than happy to help support with. In fact, 2 years ago, I served as like an MLSS coach specifically for Red River Valley to help with that process. So I'm more than happy to help with that sort of alignment if you have a curriculum or a particular model that does not necessarily align 100% with what's in the New Mexico instructional scope. So when we think about kind of the requirements for schools, every year we have to fill out the self-assessment. And there are kind of 5 areas that we look at. The first is our core instruction module. I refer to this just as our good teaching module, right? These are all of those good teaching practices that we want our schools to be engaged in. So these are things like grade appropriate assignments, research-based best practices, things like that. Our second area is targeted and intensive interventions. This includes our layer 2 and layer 3 intervention levels, as well as progress monitoring for those interventions. So MLSS really wants to focus on data and how data-informed decision-making needs to happen. So having that progress monitoring kind of really strong when it comes to how teachers use it is something that we really, really support. Because y'all are going to be opening up new schools, you really have the opportunity to create some specific progress monitoring systems and have those kind of in play from the very start. Next, we look at school-wide supports. So these are things that help support teachers and students, things like professional development, things like kind of how your master schedule is structured. This is really looking at the ways that administration and kind of the back end of school can help support students and teachers, right? So because you might be using different models, this will look different at any given school. There will be some similarities. For instance, can your administrators read an IEP, right? We definitely want that. But if our model is really land-based focused, then we want to make sure that we have those land-based focused components in the school-wide support. If we're a STEAM school, for example, we want to make sure that we're really good at ensuring that we have both the STEM portion and the arts portion aligned in terms of our structures. Whole person supports really looks at the social emotional supports for students and teachers. And then it also looks at kind of the systems we have in place. So we're really looking for non-punitive systems of support, right? So trying to keep kids in school as opposed to suspending them, right? Really looking at how we can integrate students who have engaged in negative behaviors back into the classroom. And then kind of ensuring that our students and teachers feel like there is a safe environment for them to actually engage in the process of learning. One of the examples that I like to give with this, because I'm a former middle school teacher, is the use of sarcasm, right? The use of sarcasm in middle school is kind of a necessity. However, the sarcasm you use at the beginning of the year is a little bit different than the sarcasm you use at the beginning or at the end of the year because that relationship has changed, right? When you're first meeting students, you don't want to be super sarcastic. However, once you get to know them, you get to know what levels you can be at. So when we're looking at whole system supports, it's really looking at things like that in order to ensure kind of this safe environment. And then finally, the community schools section is really looking at how we engage parents and communities in the process of education. So this aligns really, really closely with the community schools grant and kind of what they're looking for those of you who might have experience with that. A lot of our charter schools choose to participate in this community schools program. One, because it's additional funding, which is always helpful. But two, the way that community schools is set up is it really, really does allow for a focus on particular models and particular ways that charter schools can function to improve outcomes for students and community. It's really looking for that active family and community participation. We ask that all schools complete the community schools section because not only do we think that the practices are really good, but it also allows us to compare the schools that get the community school grant versus those that don't, and make sure that we're actually spending money effectively, right? When it comes to that community schools grant. So this is the general flow of MLSS, and this looks a little bit more complicated than it actually is. So all students start at layer 1. These are universal supports for all students. So all students will get this good teaching layer. Now, if there's something going on in layer 1 that a student's needs are not being met, whether that is a learning gap, a skill gap, or an advanced learning need, right? So something outside of layer 1, then they move to layer 2. Layer 2 is targeted interventions for some students. The general feel of layer 2, if you think back to elementary school, is that U-shaped table where a teacher sits in the middle with 4 or 5 kids and they're working on one particular issue, right? This is our very intentional small groups. When we think about interventions, interventions have 3 components: the teacher, the tool, and the goal. Oftentimes we mistake computer programs as interventions. They are simply a tool, right? So you need the teacher, the tool, and the goal. And the goal should be a SMART goal, right? It needs to be specific, measurable, all of those things. And when we have the goal, then we start collecting data. And we're collecting data both in the classroom and then kind of more formally every 2 weeks. And we're looking to see whether or not the student is tracking towards meeting that goal. For most of our students who have a learning or skill gap, the goal is always going to be proficiency, right? For our students who have an advanced learning need, it's going to be potentially proficiency in a higher grade level or proficiency in some other component aspect of that work. If we have evidence that the student is not showing any growth, then we might potentially look at layer 3. These are intensive interventions, which are primarily one-on-one because the need is so great that they need to have that level of specificity. It is really, really hard for teachers in the general education classroom to do layer 3. From a practical standpoint, they simply do not have the time. From a kind of more educational, pedagogical standpoint, they might not have the training, right? So not all of our teachers are reading specialists, right? So layer 3 is primarily done by reading and math specialists, by interventionists, right? Or on the behavior side of things, our counselors and our social workers. So we really want to make sure that when we're setting up our systems, right, which y'all are doing now, that we're creating an environment where we have really strong layer 1, we have really strong layer 2, and then we have the supports in place, which I know for a lot of our charter schools, having an interventionist is difficult, right? Just because of cost. So if you're not able to have an interventionist, really honing in on the first 2 layers is going to be where you want to focus. And the 2 things that we're really focusing on when it comes to selecting interventions is fit and fidelity. So have we chosen the right intervention for the right need? And then are we giving that intervention correctly? And what we've kind of found across the state, we visited about 1,500 classrooms between 2023 and 2025, is about 3%, 1.5% to 3% of classrooms in the state of New Mexico have this. And part of that is because a lot of our teachers do not have training in how to pick specific interventions. So as you're working to set up your professional development pipeline, right, that first year of professional development you want to do, you want to make sure that you're focusing on getting teacher support and how to select particular interventions, right? Because that's going to be really key for getting this framework to function like it's supposed to. Again, want to stop? Questions, comments, thoughts, concerns?
This is such a quiet group, no questions.
Well, and it's surprising too, because I know most of the people on this chat, and I know they're not quiet people. All right, if there's no questions, we'll go ahead and keep moving forward. Like I told Kat earlier, if you want me to come and give this training to your teachers or a more in-depth explanation at any point, reach out to me. I'm more than happy to do so. So one question about MLSS is funding, right? Where does the funding for MLSS come from? So because MLS is a framework, you're essentially combining funding from other parts to get MLSS in the process, right? So your high quality instructional materials flow into MLSS, right? Your professional development, your Title I, Title II flows into MLSS. So you don't actually have to pay anything directly for MLSS to function, right? Because it's more of a framework that you're kind of slotting parts of the education process in. So this is not one thing where you have to go, I need a whole bunch of money for, right? Having previously worked at a charter school, I know how difficult funding can be. So this is going to be more about getting these systems in place as opposed to having to purchase or buy anything new. So that's MLSS in a nutshell, right? That's a very high level overview. Next, we're going to move on to gifted education. There has been a misconception in the charter space that charters do not have to provide gifted education. That is incorrect. Gifted education is a requirement for all public schools in New Mexico. So you have to provide gifted education. Gifted education in the state of New Mexico is protected under special education law, right? Gifted is considered an exceptionality. It gets a little bit weird because gifted is not covered under IDEA. It is not federally funded, but it is protected and funded through New Mexico state law. So it gets a little bit wonky. So when we're talking about giftedness, we're talking about exceptional ability in one of or multiple of these 6 areas. General intellectual ability is what we traditionally think about when we think about gifted students. These are students that have high capability for memory, high processing speeds. These are students who are able to grasp a concept after 1 or 2 kind of examples, as opposed to the more traditional like 5, 6 that their on-level peers would be. Specific academic aptitude, these are students who are really, really advanced in a specific academic area. So you can have a student who is highly advanced in math, but is on level or behind in their other subjects. And there are several ways that we can assess for that we'll talk about here in just a minute. We have creative or divergent thinking, right? These are our students who come up with kind of novel new ideas or ways at looking at particular situations that are kind of outside the norm. Our problem solving and critical thinking students are our build a better mousetrap kids, right? They're the ones who come up with shortcuts, the one who comes up with novel ideas on how to solve issues. These 4 are fairly easy to assess with a kind of standardized test. The last two, leadership and artistic ability, there are some standardized testing methods for this, but primarily it's a portfolio system, right? Where we're collecting a whole bunch of data. So leadership is the ability to kind of look at a social situation and influence that social situation. The example that I like to give to teachers is think about the student who is your instigator, right? Not the one who gets in trouble, but the one who gets other kids in trouble, right? They're the ones who kind of are able to read the social situation and influence it. Artistic ability is exactly what it sounds like. These are our kids who are weavers, silversmithers, jewelry makers, painters, actors, play instruments at a very high level. So a lot of the work around identification with leadership and artistic ability is going to be based particularly around the communities that you're in. So for example, what gifted jewelry making in Gallup, right, Shiprock looks like is going to look a little bit different than what it will look like in Las Cruces because there are culturally specific components, right? Same thing that with leadership, right? Leadership in FFA looks very different than leadership on the football field. So we really want to make sure that we're working with our communities and our families to come up with what we're considering gifted in those particular areas and how we want to assess for them. A lot of our smaller schools and our charter schools work with local universities, local colleges, or local artists and city leaders to kind of help come up with some of these definitions. So that is something that can be really, really helpful. There's also a small group of Albuquerque charter schools that have worked together to kind of create some of these processes themselves. So you are always more than welcome to work with your local communities, with your charter school partners, all of that to come up with these processes. So when we're talking about gifted, there are a couple of requirements. The first requirement is universal screening. So this is again in the NMAC, the New Mexico Administrative Code. 631.3 is the gifted rule, and 11 is where we get into universal screening. So by the end of third grade, all New Mexico students have to be screened for potential giftedness, right? Most schools either select second grade or third grade. Second grade, second semester is kind of a really good time to do this universal screening because there are no other screeners that have to be happening during that time. And our students are kind of more used to testing at that point. If you select third grade, right, our students are a little bit more experienced when it comes to state assessment. They're also a little bit more mature. So there are kind of pros and cons to either. And each school is allowed to select which grade level and which assessment they want to use. So we have the Gifted Technical Assistance Manual that you can find on the PED's website that has a whole list of potential screeners and assessments in each area. Most of our districts and charters use the COGAT, COGAT, or the Neglieri. The easiest way to look that one up is to look up NNAT-3 as their screeners. These are relatively cost-effective screeners, and they will screen for multiple areas, right? So for instance, both the COGAT and the Neglieri are used to screen for both general intellectual ability and problem-solving, creative thinking. Then we can use assessments that we already give in the classroom or state assessments to look at specific academic ability, right? Specific academic achievement. So that's the first requirement for gifted education, right? That universal screener by the end of third grade. When we're thinking about universal screenings, you will need to create a policy around cutoff scores. So what students are going to be allowed to move past the screening process. So the National Association for Gifted Children suggests that around 8% of any given population is gifted, right? So we're really looking for an identification rate that is around 8%. So some of our districts and charters, what they do is they take the universal screener and then the top 15%, regardless of what the score is, they will give the assessment, the full evaluation to. Some of these cutoff scores can be in the 88th percentile, the 90th percentile, right? We're less concerned about kind of what that specific number is and more concerned about how that relates to your general population. Wait, let me go back first. Questions about the universal screening process? I can think of one question you should all be asking. Where's the money? Right? Is gifted funded in the state of New Mexico? Yes, it is. Right? So all gifted students receive a multiplier to the SEG that is exactly the same as students with disability. So your students who are A and B level will get a 0.7 multiplier to the SEG. Students who are C level will get a 1-point multiplier, and students who are level D will get a 2-point multiplier. I want to say the 0.7 multiplier is roughly $4,300 a year. It fluctuates based on student unit value, right? You can use those funds to pay for the universal screening and evaluation process, curriculum, gifted staff. Several of our schools and charters are using their gifted funding to provide stipends or reimbursement for getting that gifted endorsement. The gifted budget code is 5040. So there is already a line item budget number for gifted that is brand new this year. So some of you who have been in gifted in the past are like, wait, what is this? It's a brand new thing this year so that we can track those expenditures. So
Mr.
gifted
Chris,
is
sorry,
funded.
can
Go
you
ahead.
repeat that budget code again, that line?
5040, I believe.
Thank you.
So what that looks like is because it's part of the SEG, it comes into operational, right? But that funding is meant to be used for gifted students, right? So one of the reasons why we've started tracking expenditures is because we want to see if we are actually providing enough funding for gifted. My guess is probably not, because we expanded gifted and how we view gifted in 2023. So we're gathering that data so that we can then propose some increases for gifted expenditures. Any other questions about universal screeners? So whoever Neely is working with and whoever Julia is working with, y'all have really good resources when it comes to gifted education. So y'all are in a really good place. So all gifted students in the state of New Mexico, when they're identified, they have a gifted IEP. And this IEP is different than our traditional students with disability. Part of the reason we have separate IEPs is because students with disability have all of the IDEA components that do not apply to gifted students. So whatever learning management system you're using, Synergy, PowerSchool, whatever, should already have the gifted IEP as an accessible document to it. So when we're thinking about the gifted IEP, we're really looking at what the current data is saying about strengths. We're looking at specific goals, and the gifted IEP generally has two goals. One is academic, one is kind of social, emotional, behavioral, right? Because a lot of our gifted students have executive functioning issues, might have some overexcitabilities around emotional kind of outbursts or the inability to sit still, things like that. We also are specifically outlining our services and specifically designed instruction. So whether that's whole grade level acceleration, subject specific acceleration, enrichment, pull-out class, any of those are potential options for services around gifted education. And then finally, we have monitoring. Just like our traditional IEPs, you have to have an annual meeting for gifted to update the IEP. So a meeting at least once a year. The good thing about gifted, though, is that once a student is identified as gifted in the state of New Mexico, they are always considered gifted. So you do not have to do reevaluations, right? So kind of once they are identified, you do not have to pay for any additional assessments unless you want to add in an area of giftedness. So we really want to make sure that our annual IEPs, we're really looking at the data to update them because we don't do those reevaluations. And again, kind of unique to New Mexico, New Mexico is one of like 8 states that has the gifted IEP and recognizes giftedness as an exceptionality under special education. So giftedness is considered part of special education for the state of New Mexico. And I know for a lot of our schools that have been established for a while, it is still difficult for them to kind of wrap their heads around New Mexico looks at giftedness differently than the federal regulations, right? The only sort of mention of giftedness in federal regulations is Title I and Title II saying you can spend money on training and you can spend money on services. Maggie?
So I have a quick question. So if it's under special ed, is it serviced by the special ed teacher provider? Or do you expect the general ed teacher to be extending that student?
It depends on what the service is, right? So our case managers are primarily our gifted endorsed teachers, right? So we want teachers that are gifted endorsed to be the case managers. And some of their services will be provided by the gifted endorsed teacher. Some services are going to be provided in the general education classroom because they're going to be things like differentiated instruction, right? Or if we have like a full grade level acceleration, that's still a gifted service, but it's provided in the general education classroom because you're essentially just skipping them a grade, right? And that's the service as opposed to doing anything different in the gen ed classroom.
So the reason I'm asking is I've just left a position where I was a second and third grade teacher, and I had a second grader gifted that was at the end of fourth grade, beginning of fifth grade math.
Mhm.
And that is such a difference for what's being taught in the regular ed
Mhm.
room. And I was constantly like, this child should be pulled for that instruction because it is so far advanced compared to what I'm
Yep.
doing on tier one,
Yes.
which is what I
So
was responsible for. So
my suggestion would be that the service there would be a single subject acceleration. So during math time, they would go up a class, right? Because they might not be kind of mature enough for like a full jump, but during that particular class period, right, you could move them forward. And that's perfectly fine as an option for servicing.
Okay.
Because you're right, there's a huge difference between second grade math and fourth grade math.
Thank you.
Other questions about this? All right, so this next one is going to be kind of our big thing that you have to do. So every 2 years, we ask every school, every charter, and every district to publish an LEA report, which is basically a full explanation of their policies, right? So the first one of these was done during the last school year. Our next one will be due next school year, so just in time for y'all to open. And basically what this is we ask you to put together a report which lays out your policies, and this is meant to be a public-facing document, right? We have templates available. There will be multiple trainings on this, but this is really explaining how you have designed your gifted program, right? What identification looks like, what programming looks like, and then how you're communicating with parents and teachers, and also what is your staffing qualifications and professional development. Now, because y'all are just starting out, you might not have a gifted endorsed teacher, right? That might very well be the case. There are waivers in place that you can get to help deal with kind of the caseload requirements to help deal with some of these issues. But you want to treat your LEA report kind of as like the goal, right? Here's what we're shooting for. And here's the really good thing about gifted in the state of New Mexico, right? Because there is no federal kind of requirements, the state of New Mexico is able to look at gifted more as I'm here to support you as opposed I'm here to slap you on the wrist when things go wrong. And because I am the only gifted person at PED, I'm who you will be dealing with for giftedness. And I very much am a let's collaborate first sort of person. So there are schools who have updated their LEA plans. There are schools who I've sat down and helped them write their LEA plan, right? So whatever support you need during this process, 100% willing to help. And while it might seem a little bit daunting in your first years to create this, I actually think this is a really good place to start because you can just go ahead and build in the systems. You don't really have to change anything. You're just building it from the ground up. And doing that actually makes things a little bit easier than having to go in and tweak systems that are already in place. So if you are not, sorry, I got tongue-tied there. So one of the things that I would highly encourage you to do is when you get my email address, please send me an email and ask to be put on both the MLSS and the gifted listserv, because I send out a ton of information regarding trainings, a ton of information about next steps through those two email listservs. So if you're not already on them, send me an email and I will put you on them because it's important for you to be able to keep up with that information. So here's my contact information. Please email me. I'm not for sure why my phone number isn't on there, but you're also more than welcome to call me, email me, whatever. I tend to answer my emails. I try to get back to you within an hour or two, unless I am doing a training or something like that. So I made sure to leave us about 15 minutes for conversation, for questions, for anything like that. So I'm going to stop sharing my screen. Um, and I know that y'all have been fairly quiet so far, but I want to give us an opportunity to kind of have those conversations, have the questions that y'all might have, and really start thinking about kind of what systems you need to have in place or what supports you would like between now and the opening of your schools.
I'll just jump in. Thank God I've got ahead of school because this is awfully darn complicated. But I think that, to me, the biggest issue, well, on both special ed, which, we really want to make sure we're doing a great job on that out here at our school. Um, uh, Being small really makes it tough. And if you've got one or two kids that are gifted, how do you figure out how to, really support them with staffing?
So right now there's some really interesting work being done out of REC 9 is the one that's out of Ruidoso, where the REC is hosting the gifted teachers for their districts because their districts are so small that they don't require like a full-time teacher, right? They might have 2 or 3 when a full-time caseload is what, 35?
Yeah.
So they're working with their RECs or with their local kind of school groups to share the cost. And that's something that I know that a couple of our charter schools have been looking at and been discussing how to kind of do that that cost sharing.
Yeah.
Because you're right, if you only have 1 or 2 gifted students, you just simply do not have the need for a full-time or even a half-time gifted teacher.
Yeah. Yeah, and that's something that we need to really start having some more conversations with the school district here as to what kind of things we can be doing together and collaborate as opposed to compete.
No, definitely. And if y'all want support kind of setting that up or what that might look like, more than happy to help with that.
Christopher, would we be in compliance if one of our teacher's aides actually has her teaching degree in special ed and then she gets the gifted endorsement as well?
So while she's working on getting the gifted endorsement, you would want to fill out a waiver.
Waiver for her. Okay.
That you would fill out both a licensure waiver and a caseload waiver. And you can find the caseload waiver on the PED website where all the waivers are. And that's just basically saying, hey, we have somebody who's not gifted endorsed who's doing our gifted IEPs, right? Here's how we're making sure the student's needs are met. The licensure component, the licensure waiver gives that teacher permission to act as a gifted teacher during that process of getting the endorsement.
She actually is considering becoming a teacher's assistant for us because she wants more time to develop her management style and learn and all those other things. So it would still be applicable if she's an assistant, not a full-time teacher?
Yeah, as long as she has the endorsement, yeah, that'd be perfectly fine.
Perfect. Thank you.
What else about MLSS or gifted or the SAT process? All right. If there's nothing else, please at any point feel free to reach out to me. I know a couple people, I know Kat mentioned setting up some professional development time for her teachers. Please let your head educators, your principals, whatever, know that I am available to support them at any time with anything that they need. And hopefully I will let y'all have like 12 minutes of time to just do whatever y'all need to do. But like I said, thank y'all so much for having me today.
Thank you so much, Christopher. Really appreciate
Mr.
your
Chris, I've already emailed you, so
Okay.
you'll have something from me in your inbox. Thank you.
Fantastic. All right. Y'all have a good day.
You too. Thank you.
Bye, y'all.
All right, and that's it for today, isn't it, Ted?
That is it. And so far for the next one, which is February 9th, like I said, we have school budget for an hour. We were finally able to get them on, but I'm still working on the others.
Okay.
But it'll be 3 hours as usual.
depends on if we
Okay.
fill all the hours, but Ted will let you know.
Okay,
And
but it's
sorry,
not
was
just
that,
an hour right now.
Go ahead,
was
Julia.
that, sorry, was that invite already sent out to us? I think you, just so I can invite the board members and so that we're all on the same Zoom link call and.
Missy, was that one of the ones that you did a long time ago? Because I haven't sent out.
I've created all of them, but I have not invited
Okay.
the schools. I've just invited you and
Yeah.
internal people. So we can edit it, and if we need to for time, and send it out, we try to send them out. It's a balance between sending things out too soon and like we can send it
Forget
now
about
and you're
it.
like, that's February, or
I-
sending it closer to the time. So
I wouldn't mind getting it like now because we've had about, I think, 2 that have double booked of us. So
oh, right, that's
Yeah.
true. We did have that happen. All right, so I will forward it to everybody, but just be aware, like it's from 8:30 to 12, and we might be cropping it down depending on who we have joining us.
But for sure, the school budget is from 10 to 12.
Right.
Yes.
Perfect.
No,
Thank you.
10 to 11. 10 to
10 to
11.
10 to 11. Sorry. I'm
You
gonna
might
make
have
them suffer
questions
and
for
sit
them
there.
until 12.
Oh, and he goes with Jerry first. Okay.
All
Sorry,
right.
I thought I was on mute.
If nobody has any more questions for us, we can end.
Thank you, everybody.
Thank you, everybody. Take care.
Thank you.
Bye.
Bye-bye.